Have a great day, everyone. Welcome once again to our Bridging Education for Biology. Our topic for this moment is Introduction to Biological Asepsis. By the way, what is asepsis? Well, to give you a brief background, asepsis is a specific technique applied in science wherein the aim is to make a part of the body clean or free of microorganisms. Now, why is it related to biology? Because one field of biology is microbiology, which studies bacteria, virus, and other small organisms, which is the one that we are taking out when we are doing asepsis or when we are cleaning our body. So without much ado, give me 1 to 2 minutes to set up our learning education for this moment. Okay? Now let us continue. Again, the title of our lecture or topic for this moment is Introduction to Biological Asepsis. This is once again a bridging education lecture, online lecture for biology concerned students. Now let us first go to our terminological introduction. First term here is infection. When we say infection, it means invasion of body tissues by microorganisms. When we say invasion, something which is a microorganism enters the body. Okay, it can be in a form of a wound, it can be through the mouth, through the nose, through the anus, or anywhere, as long as it can enter the body. Now, when one enters the body, who is not needed in the body or which is not needed in the body, you call that invasion. That's why infection is an invasion of body tissues by microorganisms. Okay, let us continue. Next here, okay, microorganisms. When we say microorganisms, okay, these are called infectious agents. Okay, so in biology, microorganisms are referred to as infectious agents or the agents that carry about the infection. Now, how about the next term here, asymptomatic? Meaning, you are infected, but you do not have clinical evidences or you do not have clinical signs and symptoms, or you are not manifesting anything that that one person with an infection should show, okay, or should manifest. Example of this is a person who has a bacterial infection should have fever. But a person who has a bacterial infection but does not actually manifest fever is called asymptomatic, meaning the person does not display or execute a symptom. Now, next here is disease. What is the meaning of the word disease? This is a detectable alteration in normal process, meaning your body is a normal system. Anything that alters or anything that does not follow normality or destroys normality is in itself called a disease. So the next term here is communicable diseases. What is a communicable disease? Well, according to our definition here, infectious agent can be transmitted by direct or indirect transmission through a vehicle or a vector. So when a disease is with one person and that person aids in transferring this disease to another person by the transfer of microorganism, that is already what we mean by communicable disease. Okay, I hope you understand this terminology as we are going further with the study of biological asepsis. Now, what is a vector? A vector is an animal or a living transporter of diseases. Now, when a disease is transferred by a living organism, it is called a vector. So an example of this is dengue. Dengue is being transported by Aedes aegypti. This is a kind of mosquito you see here. This is the mosquito, this is Aedes aegypti. Now, if one person was infected with dengue because a mosquito carried this disease from one person to another, then you call this mosquito as a vector. Now, on the contrary, if the one that transferred the disease is not a living organism, it is called a vehicle. So it is just like a vector, but this time it is a non-living organism. Now, an example of this is this syringe or this injection. Now, if you are injecting this, and all of us and unknowingly, this was already used by another patient, and this needle has actually AIDS or acquired immunodeficiency syndrome, and it was injected to you. And because of that needle injection, you contacted AIDS. You call the transfer of AIDS from one person to another as transmission or contamination through a vehicle. Why? Because an injection is not actually a living organism. How about virulence? This is the capacity of a microorganism to cause a disease. Meaning, this is the strength, this is the force, this is the stamina of the microorganisms, the virus or the bacteria, to cause that disease. Now, example, a virus enters your body, but the virulence is low, then your body will be good enough to kill that virus. But when a virus enters your body or a bacteria enters your body and it's very strong and it has the tendency of defeating your immune system, then you call that a very strong virulence. Okay? Lastly here, pathogenicity. It's the ability of the microorganism to produce a disease. Okay? So if the virulence is the causing of the disease, pathogenicity is the disease happening. So example, okay, let us talk about COVID. Okay, so if one person coughed and this microorganism transferred to another person, the tendency of that person also displaying cough or displaying symptoms depends a lot on how many of those virus transferred. You call that virulence. If enough virus transferred and the person got sick, you call that pathogenicity, because that is the ability now of the microorganism to produce a disease. So therefore, if a microorganism transfer from one person to another, maybe by virtue of a cough, and the virus is not enough, the body will be strong enough to defeat this virus. So it is very possible that by the microorganisms with weak virulence will not cause pathogenicity, meaning it is possible that even if you are infected, but the infection was caused by a weak virus or a weak bacteria, your body will be good enough to defeat that, and there will be no disease that will transpire. Okay? Very well, let us continue. What is a pathogen? A pathogen is a microorganism that causes the disease process to happen. So, your pathogens may include virus, bacteria, protozoa, parasites, okay? So you call them as pathogens, meaning these are the microorganisms that causes the disease to happen. How about opportunistic pathogen? From the word opportunity, these pathogens are only waiting for the time when there is opportunity and they will strike. Why? Let us try to understand what is an opportunistic pathogen. It is a pathogen that only causes disease because another disease happens or the body lost its ability to stand against invasion. Now, let me make that thing simple. Okay? If a person has AIDS or acquired immunodeficiency syndrome, the person is becoming weak. Because the person is weak, tuberculosis or bacteria causing tuberculosis will be will have an easy time entering the body because the body cannot fight the bacteria because it was weakened by AIDS. So, bacteria causing tuberculosis finds an opportunity to infect the body without resistance. You call that opportunistic pathogen. Okay? Now, another term here, colonization. When I say colonization, okay, it's a process by which strains of microorganism becomes a resident flora, meaning the microorganism that invades the area capture the area and live in that area. That is now colonization from the word colony. So it may grow in multiples. Infection occurs as soon as these groups try to invade a part of the body. So it is very possible that bacteria enters the body, it forms a colony somewhere. Now, when it is already very strong, it invades the kidney, it invades the lungs, okay? And that is where infection happens. Now, we have two words here that almost are used interchangeably by other people, but they mean differently. Bactericidal and bacteriostatic. When you say bactericidal, bacteria here is really killed. When you say bacteriostatic, bacteria here is only weakened and restrained so that our human body can fight and terminate it. Now, example, bacteria enters the body. If the body puts in a bactericidal effect, the body kills the bacteria right away. However, there are instances when bacteria enters the body and then some of our immune system weakens the bacteria. Some of our medications weakens the bacteria so that our immune system can definitely defeat the bacteria because this bacteria might be very strong. So you call that effect as bacteriostatic. Now, why is it that we are not always giving bactericidal medications? Because the body might assume that every time there is infection, medications will kill them and the body will not function anymore at par. But if you give bacteriostatic medication, medications only will weaken the organism. It's still the body that kills the organism because they are now stronger than the organism. So that is what that is the difference between bactericidal and bacteriostatic. When you do not want to kill the bacteria, you just want to weaken it so that the body can conquer it. That's bacteriostatic. But when you want to kill it because the body may not be able to kill it, that is bactericidal. Okay? Now, we have now asepsis and sepsis. Asepsis is freedom from disease-causing organism used to decrease the possibility of transferring microorganisms from one place to another. In short, these are techniques that produces cleanliness. Okay, what happened to my video? Okay, there you go. Now, so asepsis is a technique that stops sepsis. What is sepsis? This is the inability of the system to withstand ground against disease-causing organism, thus resulting to infection or disease occurrence in certain system. When I say sepsis, it's already invaded by microorganism. So we do asepsis, meaning we remove the microorganism to make it clean again. So when one is under sepsis, one is what? Very prone or is already under infection. But, okay, when one is performing asepsis, it's either the person is curing something or is preventing something from infecting the body. That is now the reason why we are studying asepsis, because we want to prevent microorganism from creating a colony on our body and producing infection. So, what is medical asepsis? We say medical asepsis, it's just trying to say asepsis of a normal person. So you are cleaning something dirty to make it clean. Okay? You limit the number of growth and transmission of microorganisms. Okay? The objects referred to as clean or dirty, soiled, or contaminated, that is what we clean. So it includes all practices intended to confine a microorganism to a specific area or remove them from our body, specifically the skin. Now here's another term here, surgical asepsis. Now be it known that the persons now are already clean, but they will clean more because what we cannot see with our human eyes are still existing in our body. We call this also sterile technique. This is practiced so that an area or object will be free of microorganisms. So if you notice now in medical asepsis, we limit microorganisms. Here, we really remove all of them. You know why? Because in surgical asepsis, we are operating or doing surgery. So if we open the skin of one person and there are germs there, even of small quantities, it will surely make infection happen very fast. That's why if medical asepsis is cleaning from dirty to clean, okay, surgical asepsis is cleaning from clean to cleaner to cleanest. So this is preventive technique for doctors and nurses who will be opening the skin of the person. And if there are dirt there or germs there, it's very possible that they get infected. And we don't want that to happen, because infection that happens in the hospital is really what? A form of negligence, or sometimes it can end to malpractice. And the hospital will be in danger because the patient got the sickness from the hospital itself. And it's not very good. It's not very nice to have a reputation like that. Okay, so see here now. As a nurse, this is what you look like when you are just performing medical asepsis. If you see, normal scrub suit and then just a clean gloves. Now in medical asepsis, you are now wearing surgical suits, okay? And then, okay, you will have your face mask, your head, what do you call it? Headgears, and then you will have surgical mask, okay? Then you have comparison here. In medical asepsis, it's only soap and water. But in surgical asepsis, you are now using betadine. Okay? 70 to 90% betadine, I think. I'm not very sure. But this is now to aim really to eliminate all microorganisms. Here, after the performance, you drop your hands down. Why? Because only the hands are clean. The rest of the body are not. But here, after performance, you raise your hand about the chest level because it is dirtier than the other parts of the body. Okay? So we have more rationally stated here. You can read about this, but I will not really dwell on this deeper because you will still study this in advanced asepsis. Okay. Now, types of microorganisms. We will now proceed to the next subtopic. Now, the first here is bacterium. This is the singular term for bacteria. Now, the meaning is microorganisms which can exist either as independent organism or parasites. Okay? So bacteria can either be independent or free living, or they can be parasitic or dependent on another life. Okay? So it came from a Greek word bacterion, meaning small rod or stuff. The plural form of bacterium is bacteria. Okay? And then the term bacteria was devised in the 19th century by a German botanist, Ferdinand Kohn, okay, during 1853. So that is your first microorganism. That is your bacteria. Okay. Second, you will have your virus. Very common today. The SARS-CoV virus causing COVID-19. Okay. Virus cannot grow or reproduce apart from a living cell, meaning it cannot be independent. It invades a living cell and uses their chemical machinery to keep itself alive and to replicate itself, meaning it's parasitic. It is self-limiting, and virus, when it contacts with human system, differs in manifestation, meaning when you say self-limiting, the virus comes and the virus goes. That's why human beings need not really worry about it, because when there's virus in the body, you just have to keep your body healthy, because when the virus comes, it's also that the virus goes. So when the virus says that the body is already healthy and it already cannot display destruction in it, the virus will just go. That is what we call by the term self-limiting. That's why there are really no cures for virus. If you have virus, you're still drinking antibacterial medications. Why? Because that is for prophylaxis or prevention from bacteria that will become opportunistic organisms. So for virus, the only thing that we can do is make your body healthy and the virus will just leave. So virus came from the word virus, meaning to poison. The plural form is viruses. Now, where did the term virus came from? Dutch microbiologist Martinus Bergenic or Bejerink, I'm sorry, was the first person to use the term virus. Okay, nice to know about that. Next, you have fungus, meaning aerobic organisms. When you say aerobic organisms, it is organisms that live only when there is oxygen. Now, such as molds, mushrooms, and yeast, which unlike bacteria can grow in low moisture and low pH environment and have their genetic material bound in the membrane. So these are not dependent, what do you call that? They can live on their own. Now, the word fungus came from a Latin term meaning mushroom. Okay, the plural form of fungus is fungi, but present languages already accept funguses. But it's still proper to use the word fungi. Now, where did the term, who invented the term? In 1969, an American biologist named Whittaker used first the term fungus. Okay. Next is parasite. Parasite is an organism that lives in or on and takes its nourishment from another organism. A parasite cannot live independently. It includes helminths and protozoa, meaning a parasite cannot live without what? Without taking food or other needs from other organisms. So it came from the Greek word parasitos, okay, meaning eating with or at the same table. The plural form is parasites. Now, Charles Louis Alphonse Laveran, okay, discovered malaria parasite in 1889. And presumably, this is also one of the earliest times that parasites were called parasites. Okay? Are you still with me? I hope you are getting a gist of what we are talking about here. Let us continue. Let us go now to the types of infections. Now, the first type of infection here is actually local infection, and it is very similar to inflammation. Okay? Local infection is limited only to a specific part of the body. So it might be that the infection is only on the knee, on one knee, or on the finger, or on the face. So it's very common with infected pimples, infected wounds, okay? So it's very localized. It's only in one area. That's why local infection also carries the same sign with inflammation. So what are the signs of local infection or inflammation? You have dolor, calor, rubor, tumor, and function lysa. What is that? Well, in English, dolor is pain, calor is heat, rubor is redness, tumor is swelling, functionaliza is loss of function. Meaning, if you have localized infection in a specific part of your body, example, your hand is infected, there will be pain, and then it will feel hot, no? There will be heat, then there will be redness around it, and there will be swelling. And if this four will prolong and no medical attention or health attention is given, it will result to the area not functional anymore because of the inflammation. That's why you will call it loss of function or function lysa. Okay. Now, you have also the second type of infection, systemic infection. From the word system, meaning it's scattered already in the system. So systemic infection means infection that spread and damages other body parts aside from the specified origin. So example, it started with the hand. It can spread to the back, to the body, to the head, and even to the foot area. You call that systemic infection. Now, what are the signs and symptoms of a systemic infection? Number one, you will have fever. Okay? So, fever here will be 37.2 Celsius and above. So if your temperature reads 36.5 to 37.2, that's normal. Beyond 37.2, there is already fever. So you will have also increased pulse rate, okay? Increased respiratory rate, okay? You will have malaise, okay? Or what do you call malaise? This is actually painful body, lethargy, tired body, anorexia, and at times also nasayan body, anorexia. Okay, this is the feeling that you do not want to eat. Nausea means you want to vomit, and vomiting is the act already of spewing out food from your mouth. Okay, that is vomiting. The act that you want to vomit or almost vomiting, you call that nausea. Vomiting is when something already comes out of your mouth. Enlarging and aching of the lymph nodes, you call that pangadlay in the dialect. Okay, when that enlarges, you can feel that, and when that is painful, that is already a sign of systemic infection. Now, so you will have also these kinds of signs and symptoms in the laboratory. Well, you will learn this later on when you are already doing advanced medical laboratory science. So just to name a few of them, you will have elevated WBC, okay, elevated RBC, positive culture of blood, of urine blood, okay, septicemia, sputum, and other drainage. So these are already technical languages you have to learn later on. Now, systemic infection, okay, is an infection that spreads and damages other parts aside from the specified region. Okay, we have tackled this already earlier. Now, we have two terms again here, bacteremia and septicemia. These are also kinds of infection. When you say bacteremia, it's in blood confirmation test levels blood confirmation test reveals presence of bacteria or other microorganism, meaning there is infection in the blood. Okay. How about septicemia? Bacteremia manifests systemic infection. It simply means that blood infection manifests infectious symptoms in different parts of the body. So septicemia is already what? A confirmation that there is already the spreading of bacteria throughout the whole body. Bacteremia is just a confirmation that bacteria is there. But the spreading is called septicemia. Okay? So you have 3. Localized infection, infection in just one place. You have systemic infection, infection in one place but scatters through all parts of the body. You will have also bacteremia, okay? Presence of microorganism in the blood, and septicemia, presence of microorganism with manifestation of already traveling in different parts of the body. Now, in terms of the length of stay of the infection, we have 2 kinds, acute infection and chronic infection. When you say acute infection, this is when infection happens first and it will take only hours for the symptoms to lead to actual infection. Okay? That is acute. When you say chronic infection, is when infection happens, okay, in a very slow manner, sporadic, and it will take days to really result to actual infection. Now let me make it a little bit simple. When I say acute infection, the length of time the microorganism enters the body and causes the infection is very, very short. When I say chronic infection, the length of time that the microorganism enters the body and the actual body results into infection is a very, very long time or very long process. So the length of time for the bacteria or for the virus or for whatever organism to cause that disease is determined by acute or chronic, because when it's short, it's acute. When it's long, it's chronic. Now, what is nosocomial infection? These are already non-common infections. Infections associated with the delivery of healthcare in nursing setting, it usually happens in the hospital. And iatrogenic infection are infections associated from diagnostic or therapeutic procedures. So I will not dig deeper into this, but I want to tell you, dear learners, iatrogenic and nosocomial infections are infections that happen in the hospital. Okay? We don't want this to happen because this can kill the patient. So the patient enters the hospital without this infection, and for the patient to to be infected from the hospital with these infections, that can be a great legal problem for the hospital, because we cure patients in the hospital, we don't infect them. Now, the hospital should be a bastion of hygiene, not an example of contamination. Now, take note. Hands of personnel are common vehicle for the spread of infection. That includes your hands, dear students. It's always the hand, because it's the hand that reaches the eyes, the head, the body, the anus, the legs. Okay, it's the hands that is used by the body to touch one part of the body and touch another part of the body. Insufficient hand washing causes 80% or majority of infection spread. Imagine that. If you will just wash your hands, you will have only 20% chances of getting infected by microorganisms. The greatest and most basic way to avoid nosocomial infection or infection that happens in the hospital is hand washing. It's the same with all of us. If we leave the house and go back to the house, and before touching anything else, especially food, we wash our hands, 80% of the time, we will not have infection. Now, it will be time for me to discuss another important aspect of the infection process. We call this as the chain of infection. Now, first, the etiologic agent, or we call it the microorganism. So example of this, the virus, the bacteria, protozoa. Second, the reservoir or the source. Let's say the reservoir, the source. It can be, okay, it can be a certain canal, a certain animal, okay. Then number 3, portal of exit. from the reservoir, it comes out of the dog, or it comes out of the canal. And then the mode of transmission, example, if it comes from the canal, okay, a person with a wound steps over to the canal, okay, and then from there, okay, germs enter the body. So this is now in number 5, portal of entry to susceptible. So this is where, because of the wound of the feet that steps on the canal, okay, microorganism enters. Okay, and after this, okay, the host, being the human being, becomes susceptible, or the host carrying the microorganism might get sick. Okay, so when the person is sick, the moment he coughs and that water and that saliva comes out of the mouth, that saliva carries the microorganism, which will again return to number 1, and the cycle will continue. This is the cycle of infection. Now, so as what I have said earlier, etiologic agents, okay, are also called microorganisms, the infectious ones. Okay, so the example is bacteria, virus, fungi. Reservoir or the source can be humans, plants, animals, or the environment. That's why a while ago we used the example canal. It's an environment. Or we also mentioned dogs. That's an animal. Portal of exit, it can be the mouth, the nose, the genitals, the wounds. Mode of transmission, this is how you transfer the disease. It can be direct transmission, meaning touching, biting, kissing, sexual contact. So it is really transmitting the disease from one person to another because of actual contact. Okay, it can also be indirect transmission. Okay, we defined a while ago a vehicle when microorganisms are transferred by non-living organism, like the injection. It can also be transferred by vector-borne. Our example earlier is when the mosquito carries a virus and transfers it to other people. Another thing is we have also the airborne transmission. When the air traveling around the room carries the virus. So there are two kinds of airborne transmission. You have the air dust. It stays in the air, suspended a lot. We also call air dust as aerosol. And you have droplet nuclei. Okay? This is only suspended in the air for a short period of time because of the weight of the saliva which it carries with it. A very good example of droplet nuclei is tuberculosis. When a person with TB speaks, okay, TB bacteria, okay, goes with the saliva. That's why if you have a distance of 1 meter, even if the person with TB speaks a lot and more saliva goes out, it will not reach you because saliva will just fall 1 ruler apart from you. Okay? Now, what is the portal of entry? Okay. So, example is fecal oral source or fecal oral entry. Okay, so it enters the mouth. And the susceptible host, any person who is at risk for infection. Okay, example, very young, very old. Immunosuppressed, say very young, the babies, very old, our lolos and lola. Immunosuppressed, those persons with weak immune system. Cancer-treated people, okay. Chronically ill, those who are suffering from very long admission in the hospital. Persons recipient of transplant. So these are persons who are susceptible host, meaning they can be, when there is an infection or a microorganism around, they will be the first to be susceptible, or they will be the first that can bog down, that can surrender to infection. Now, our aim here is to break the chain of infection. So the first here is, we mentioned earlier, infectious agent. If we remove the infectious agent, okay, how do we remove the infectious agent? By correctly cleaning, disinfecting, or sterilizing, okay, everything that we use, and by educating clients or people about appropriate methods of cleaning, disinfecting, sterilizing. Remember, this is a chain. You just break one chain, everything will die. So that is first, if we will destroy the infectious agent. Second, if we destroy the reservoir. So we change dressing, okay? Next, if we, okay, what are the portal of exit? Our mouth, our wounds. So if we will talk, we will wear mask. If our wounds are covered, then the portal of exit cannot let a microorganism come out. Okay, very nice. Next, mode of transmission. So example, the mode of transmission is touching of one person to another. So before touching, you wash your hands first. Therefore, microorganisms are already what? Okay, taken by the soap and the water that you use when you hand wash. So you hand wash before touching another person, you are safe from the transfer of microorganisms. Next, portal of entry. Use sterile techniques. This is where already we say when you are injecting, be sure it came from a package. It came from something that is sealed. Do not reuse needles because it can be a portal of entry. And then susceptible host. Well, if you think that your immune system is down, try your best to do everything to make it up. A good immune system will not make you susceptible. Meaning, if you have a healthy body, there's a great tendency that even if the germs, the microorganisms already around you, you will not be infected because your body can have defenses and can defend you from the enemies of the body, which are the germs and the microorganisms. Now, proper hand washing. Of course, we have instructions here. Okay, opposite palms, 20 strokes, same direction, palm. And then you have finger joints, phalangeal rub, single finger strokes, palm scratch, wrist watch. Okay, now you have demonstration here. So this is your opposition. Okay, same direction. You have your fingers and joints. You have your phalangeal rub. Okay, and then you have your single finger rub, palm scratch, and then wrist wash. Now, to understand further, you can always go to YouTube videos and then search hand washing, and then you will have actual demonstration there. Okay, these are already very much proliferated in the internet. Actually, in the module, I have already placed there a video of hand washing. So, factors influencing the virulence of microorganism. When you say virulence of microorganism, the strength, the capacity to infect, the capacity to let one person get sick. Number one factor is number of microorganism presence. Of course, when you have only few microorganisms present there in your body, it cannot produce sickness even if you have already that virus. Why? Because they are too few. The body can handle them. Number two, virulence and potency of the pathogenicity. Meaning, even if the virus is just few, but they are really known to be dangerous and strong virus, they can still infect you. Number three, ability to enter the body. Now, if your body has wounds, if your body has breakages, if you are not too clean with your hands and you always touch your eyes, your mouth, and everything that has mucosa that can enter your body, then it will enter your body. Susceptibility of the host. We're talking here about the immune system of the host. Remember the too old and the too young? Okay? The too young has not developed yet a complete immune system. The too old has already an old immune system also. So they will really be in danger of being infected. And number five, ability to live in the host body. So example, germs and microorganisms live in your body already, but the body is too strong for them to conquer. Then their virulence will not also succeed. So even if the virus is strong, if the bacteria is strong, but the body is also strong, there's a tendency that they cannot have a full-blown infection. They will only have signs or little symptoms. Okay. Now, let us go to the very popular coronavirus that caused COVID pandemic. Now, the COVID-19 is caused by a kind of coronavirus called SARS-CoV-2 virus. This is a specific virus causing the COVID-19 virus. The mode of transmission, how are we infected with COVID, with coronavirus causing COVID? Number one is aerosol. What is aerosol earlier? When these things becomes very, very small and they suspend in the air. Okay, that is aerosols. Aerosols. So example of aerosols are in air-conditioned room, okay, machinations, okay, and then another one is droplets. This is what we said earlier, that some microorganisms travel with saliva. That's why they cannot suspend very long in the air. They will drop right away to the ground. That's why what I said earlier, if you have tuberculosis, if you have TB, you don't have to wear mask or anything. You just have to stay 2 to 3 rulers away from the person with TB. And then when the person with TB talks, even if they will have saliva coming out of their mouth, it will not reach you because saliva will only travel 1 to 2 rulers far, and it will drop to the ground because it cannot suspend in the air because it's a droplet. Okay? Next, virulence is depending on viral loading. So when you say COVID, that's why it's very important that we follow government's rule of social distancing or wearing of the mask, because if you wear a mask and a person near you has COVID virus, some of those virus might enter your mask, but it will not be enough. The mask will what? Will be a very big help to stop most of the virus entering. So you might have virus in your mouth, but it's not enough to what? Make you sick. Another good thing is social distancing. When the person is far from each other, okay, when virus travels towards you, if it's an aerosol, it already travels somewhere else. If it's a droplet nuclei, it will only fall in between of you and not directly go into your system. That's why if we only practice social distancing and mask, the tendency of having COVID is very low. That's why there can be asymptomatic occurrences if we are following government's order of social distancing and wearing mask. So the symptoms of COVID are just like common flu. So you will have headache, fever, maybe difficulty of breathing, okay? But rare cases wherein the persons have already conditions like high blood, diabetes, and everything, COVID can be dangerous, okay? When mixed with, okay, other sickness present in the body already. Another thing that makes COVID very dangerous is if you have a lot of virus which enters your body. If your viral loading is very many, tendency is you will have severe COVID and you will die. Now, I hope that you have enjoyed our discussion about biological asepsis. Okay, let me first finish this slide share. Now, welcome once again to our actual window. Now, biological asepsis is very important if you are pursuing a medically related or health related course. That's why you have to understand more about the activity of microorganisms and how to stop them from becoming virulent. Okay? And in that way, you will become an effective healthcare personnel. I I would like to say that our lecture here is very elementary, or it's only an introduction to the actual biological studies on asepsis. There will be deeper studies, but our aim here is to give you a background, to introduce you into the world of biological asepsis. And we have attained our objective. Thank you very much for listening to our lecture. I hope and pray that these things will remain in your mind until one day you will become already successful healthcare personnel. May God bless you, and to God alone be the glory.